On today's episode of Sports Medicine Weekly, we visit with a physical therapy expert talking about the importance of load strengthening for return to play. When should someone go to a physical therapist? Do you need a doctor in order to see a physical therapist? Do patients, athletes need to continue doing their physical therapy exercises forever? All this and more on today's episode of Sports Medicine Weekly. One of our sponsors is Vericel. Vericel develops, manufactures, and markets autologous cell-based therapies for patients with serious diseases and conditions. For more information about their products, visit VCEL.com. Dr. Cole, great to visit with you once again, and interesting topic here about physical therapy, wouldn't you say?
It is, because I think it's sometimes poorly understood, and unfortunately it's looked at sometimes as a commodity or other things can replace it, but it has a really specific role. And look, Steve, physical therapy is something that can be done after a concussion appropriately. It can be done with medical problems and so forth. But in the area that I live in, musculoskeletal medicine, we make heavy use of physical therapy, even, for non-surgical things. And I know you had plenty of physical therapy in the early phases after your shoulder surgery that we did. So it's I often think of us as surgeons as sort of start establishing the foundation, but that's like 15% of it, and it's everything that follows suit. For example, after a surgical procedure that engages with therapy and time and the dedication of the patient that actually leads to a good outcome.
Well, our guest in this episode is Ted Kurlinkus, physical therapist at Rush Physical Therapy out of the Lincoln Park area in Illinois. Ted is he's dual board certified in orthopedic and sports physical therapy and a fellow of the American Academy of Orthopedic Manual Physical Therapists. Also the team physical therapist, I should say, for the DePaul University Blue Demons. That's where I went to school. So Ted, thanks for working on our athletes. I appreciate it. And Ted, thanks so much for joining us here on this episode of Sports Medicine Weekly in our podcast. I want to talk about, first of all, the importance of load strengthening for return to play. But first of all, open us up with a thought about when someone should see a physical therapist. Dr. Cole touched on it. Let's get your thoughts on that.
Yeah, I would say generally what I tell people is if you have pain, you should see a medical provider. If you have pain related to activity or movement, you definitely should see a physical therapist. We have people often coming in saying, I'm getting a little older. There's a lot of wear and tear in my body. That pain's kind of normal. And I always tell people, pain is not normal. There's something we can typically do to address that pain to make you feel better, feel differently, and do the things you want to do. So if you're having pain with activity, with things you're doing day to day, even if it's sitting at work, standing at work, moving throughout the day, that's the time you should see a physical therapist.
Ted, it's interesting. Pain is one of those subjective variables that I talk about a lot in the office. This week, on a typical office day, that is a part of every conversation I have with a patient, because the interesting part about pain is that it isn't necessarily associated with disease progression or worsening the problem, but it's very dissatisfying. And one of the things that I've come to recognize over time is that you could have the exact same condition from person A to person B, but their level of pain that they experience is dramatically different. Ambient disease, meaning rotator cuff tears are, 6 to 7 million people over the age of 60 have rotator cuff tears, but most of them don't have any pain or dysfunction. We only fix about 500,000 of them a year at most. So that means there's lots and lots of people walking around with no pain. And what we really struggle with is why someone has pain and another person doesn't. And that's where I've learned about the value of therapy, because there's a number of conditions that the reason people start to become painful on an underlying pre-existing condition that's probably been with them for some time is because there's an imbalance of something that previously was in check, but then they start to experiencing symptoms due to their underlying disease. And that's why I honestly hold you and our therapists in such high regard, because a good day in my world as a surgeon is to keep someone out of the operating room.
Exactly. And I think, like you mentioned, talking about pain, we talk about pain all the time. And pain is a very individualized experience for somebody. So, it's not an objective measure. Someone could have the same life, the same imaging, the same anything, and their pain experience might be very different. So I think it's important to understand, for the people listening to this as well, if you're having pain, don't let someone tell you that your pain isn't real or your pain is not significant, because that's a very individualized and specific experience people have with pain. And it's important to understand why it's happening, but also how you're experiencing and how it can be related to your daily activities.
Hey, Dr. Cole, take me back to when you first started in medical practice and being an orthopedic surgeon, where, all of a sudden there's this explosion of physical therapy facilities now. What was it like? I don't remember back 20, 25 years, if I had a knee injury I suffered in 8th grade that I remember in, Pee-wee football, so to speak. What was it like? Did we have these physical therapy places, facilities?
I remember I would go back to 20 years ago. We definitely had physical therapy places, but there were fewer sort of franchises or organizations or enterprises, and it wasn't on every corner. I think, like any business, Steve, it's supply and demand, and I don't necessarily think the popping up of physical therapy centers has created demand. I think that the supply side is generally there because there's been a number of sort of studies investigating outcomes and the importance or the value proposition of physical therapy. I think it's changed over time. I think, and we should talk about a little bit on our episode here about, how do you know enough is enough, and where do you really need therapy, and where does therapy meet home exercise or, the personal trainer. But I too have found it fascinating, as you're intimating, that there's so many physical therapy centers. They're on every street. I used to live in New York, and it was like having you can get a mani pedicure on every single corner in New York, or you can walk into a deli on every corner. You get a slice of pizza on every street. Physical therapy centers are kind of like that, and it's not well differentiated. And in the eyes of some, it's commoditized, meaning, one versus the other is there a big difference, but I think that's not necessarily true. But I will say, on the whole, the training and the specificity that these people come out with is on par excellent. And they're like doctors in terms of, how they deliver things very precisely, but they have an advantage over me. My office visit is 5 to 10 minutes, and I have to kind of figure something out and also make the patient feel that they're cared for and, create a whole visit around that. A therapist gets 45 minutes to an hour on occasion, sometimes longer. They really they become their therapist, not just their physical therapist, and they build a relationship. I mean, think back to when you had your shoulder therapy. Did you work with one therapist the whole time, or one or two?
One or two, yeah, mostly one, and it was critical. It was vital. I really needed it. And then I went to another physical therapy, what do we call it, facility, a different group, because they did some dry needle that I thought was very effective. So, and I'm continuing on with my shoulder physical therapy, even though we're 2 years post-op, so to speak, when I had my operation with you, just for strength and mobility now, to help my golf swing. Yeah.
But when you think about in your post-operative phase after you had therapy and where you are now, what did you ever get to a point where you're saying, yeah, I think I've exited the need to have someone like Ted work with me, and entered the space where I can do these things on my own? And were there still some remaining things you're like, look, I'll never be able to do this on my own, and I need some freshen, some visits to sort of freshen things up a bit?
Yeah, both, all of the above. Yeah. I mean, I think I asked you for a so-called prescription to continue on because I felt like I wasn't there yet. I just wasn't satisfied because I want to pitch to my kids. I want to play golf. I want to stay active at my age, and felt that very necessary because the shoulder it's a difficult operation. I mean, to this day, there's still some pain and soreness and everything, but I've learned how to help myself with stretching and when it's strong, but there's still some mobility issues. So I found the person that was just awesome for mobility and strength and everything. But Ted, let me bring it back to you. What separates you guys at Rush Physical Therapy when Dr. Cole says, there's so many different physical therapy places? How do you guys separate yourself?
We have a lot of people, including myself, who specialize in different areas. So I specialize in orthopedics and sports physical therapy. We have people who specialize in concussion management and vestibular therapy. We have people who specialize in pelvic health. And Rush Physical Therapy really encourage us and give us the opportunities to specialize in those things. So I think it's nice to have a company like this where there's specialties in all different areas. So if I see someone and I say, hey, I think you could really benefit from somebody else who is maybe better trained in this specific area, whether it's concussion management, vestibular therapy, whether it's a pelvic floor patient, pelvic health patient, who might need someone with a little bit more experience in that area. It's nice to have those different specialties that we can kind of pick and choose from and say, hey, especially in Chicago, just down the block, there's someone who specializes in this. We have, like it is a clinic, around a lot of different areas of the city. So we're not saying, hey, there's someone that specializes in what you need to be seen for, in Schaumburg, you need to go out there and see them. We have a lot of different specialties within the city, and I think we encourage that, encourage people to specialize in those different areas, and I think that's really beneficial to the patients we see.
Ted, let me ask you a question along those lines of expertise. I think the biggest thing in managing patients with orthopedic or musculoskeletal injuries is that transition from sort of recovering, and then a return to sport. And I will tell you, and I'm sure you've recognized it, there's an enormous psychological aspect of feeling okay to resume activities, especially when if a sport caused their injury. So tell me how you address that in your training and the way you approach it, for example, at Rush Physical Therapy, in getting someone back to sport and helping them overcome their trepidation, and also just ascertaining physically, are they ready?
Mm-hmm. So you're right. Psychologically, returning to sport or returning to play or any activity like that after an injury is challenging for anyone. There's outcome measures, so scales we use, questionnaires that's kind of rate how confident you are in doing these activities, rate how comfortable you feel returning to the sport, and rate what do you think the risk of you being re-injured are. And there's thresholds for those questionnaires that I base, where are we in this progression? How comfortable are you returning to sport? And the big thing I say to people who are going back to high level activity, especially before they return to, let's say, practices or games or whatever activity they want to be doing, is I tell them, I want to look at that activity. We're going to break it down in the clinic, and we're going to first perform each part of that activity in the clinic in a controlled environment to show yourself, psychologically even, that you're able to do it. And then we're going to build up in the clinic and in physical therapy, build up to kind of the full speed, full sport specific movement. So the thing I tell our athletes at DePaul is, I want to do everything in clinic that you're going to have to do in your first practice or first game before you get there. So you've done it, you're confident, you're not going to be hesitant returning to play, you're not going to be hesitant doing those activities.
I want to ask you, Ted, about the typical length of physical therapy and how long should physical therapy go, and some things that Dr. Cole touched on as well. But first, thanks to our sponsors, a couple more here. This episode brought to you in part by Karen Malkin's new protein brownie bar and superfood bars. Best tasting bars on the market, certified gluten-free, paleo, no added sugar. Karen's protein brownie bars and superfood bars available on Amazon and at KarenMalkin.com. Also, JRF Ortho, they partner with orthopedic surgeons to improve the quality of life of patients by enabling them to have an active life through the generous gift of cartilage and ligament transplantation. Please go to jrfortho.org to learn more. Sign up to be a tissue donor at donatelife.net. Back with Ted Kurlinkus and Dr. Brian Cole. I'm Steve Kashul. It is our Sports Medicine Weekly podcast, and this episode brought to you by a number of our sponsors. And Dr. Cole, do you ever suggest, when you see a patient, say, you know what, before we do surgery, let's check out physical therapy first? I would imagine that's pretty common. Is that common though?
I think it's common. Maybe has to be more common, because I can tell you, being an orthopedic surgeon for nearly 25 years, I know that our outcomes are often dependent upon the preoperative state of the patient. So specifically, Steve, when someone, for example, dislocates their shoulder, there is an enormous amount of trauma that goes into that. and they often develop capsulitis or inflammation in the shoulder joint, and rushing them to surgery, if surgery were properly indicated, can be a problem because of the risk of developing postoperative stiffness. An ACL is another one. I remember when I first, one of my most visible ACL patients, Derek Rose, when we did the surgery, the media was often very critical and saying, hey, why are you not doing the surgery tomorrow so we can get him back quicker? And you have to explain to people that there's a timing issue, and it's a little bit of an art form to say that a patient's ready. And after, for example, an ACL tear, the first 48 hours, the patient can't straighten their leg, hamstrings are in spasm, they have swollen knee, and they have pain. That's about the worst environment to ever do surgery on a patient, because the risk of postoperative stiffness goes up to about 15%. If I send them to physical therapy, like we're talking about, they would work on muscle relaxation, getting the swelling down, getting the pain down, and really helping the patient look normal on the day of surgery, except for the fact that they can't participate in cutting sports that led to their ACL injury to begin with. So prehab and having the acuity, I will tell you, in the clinical setting for patients. So if you're a patient out there listening to our podcast episode and you have experienced or, unfortunately might experience an injury in the future, the timing of surgery is really important, especially for acute injuries that need surgery immediately. And there are some largely soft tissue injuries, not necessarily fractures, but soft tissue injuries that you're often better off waiting, having the patient engage with a physical therapist, doing prehabilitation and optimizing them, readying them for a surgical intervention.
It's interesting because I would have never guessed. We've been doing this show for over 10 years now, and I'm familiar. We've talked a little bit at length about the Derek Rose injury and his surgery. And I always think, you couldn't do the surgery within 48 hours because of the swelling going down. But now you've added another element, Dr. Cole, that I never heard before. You could go to a physical therapist to, as you said, relax that knee. There's more technical terms that you use, but I never thought of that end of it. That's really interesting. Ted, can you elaborate on that? I mean, do you ever see someone that, torn ACL, Dr. Cole's going to do surgery in a prescribed time of, 48 hours or, in 3-4 days. You can go to a physical therapist to help that process, right?
Absolutely. And that's just like Dr. Cole said, if we can get, full bending and straightening of the knee back, pain without pain, as well as build up a little bit of quadricep activation or strength before surgery, those things are only going to come back quicker after surgery. So we're looking at getting, after your surgery, especially if, let's say, an ACL or a knee surgery, we're looking at getting quad strength, hamstring strength, and just range in your knee back. And those things have been shown to come back quicker and with less pain and easier if we've worked on them before. So the patient goes into surgery with good range of motion and good strength. They're going to come out and have an easier time getting those things back after their surgery as well.
I brought up the question of typical length of PT, of physical therapy. Is that just a tough question because, an ACL is different than my shoulder surgery? I think I went for a few months and then I continued on. I mean, these things are so variant, right? I mean, it just, it's hard to tell somebody you're going to be, maybe for a specific injury you can tell them, but to say generally you're going to be seeing someone for 2-3 months on a typical surgery, you just can't say that, right?
It's challenging because we, especially, in orthopedics, we see such a wide variety of things. We see post-operative patients. We see non-operative patients. We see patients who are coming in saying, my knee is a little sore. I'm beginning to train for a marathon or a race, whatever it may be. Preventatively, what can I be doing in terms of strength, in terms of mobility, in terms of anything to prevent injury too? So I think that's one piece that I like to see the profession moving more towards as well, is preventative injury screens, preventative activity, preventative exercise. So we're not seeing these injuries. In healthcare in general, I think we see people after they're injured, after they're sick. I think it'd be helpful, and we're trained for that, to see people before they get injured to help them prevent those injuries as well. So it could be a couple sessions to talk about what we can be doing during your marathon training. It could be a couple months after a serious injury and a surgery. So it greatly varies depending on the patient. Yeah,
to his point, Steve, it's soccer season now, so my 15-year-old is playing soccer, and I watch them on the field, and you look at, there's I don't know, it looks like 30 kids running around. They're 15 to 17 years old, all girls. And as you know, girls have an incidence of ACL tears is like 5 to 7 to 1 for boys, or women versus men. And it's like a little ACL factory out there. I mean, it's crazy because you watch how they run, and they're not often fully developed yet in terms of their musculoskeletal acuity, and it's like watching little birds run around there with not a lot of muscle strength or control. And ACL is a great example, like we've already talked about, because there's some data, for example, in the NCAA in women versus men in terms of ACL prevention. There's some data that suggests we can reduce the incidence of ACL tears in women more than men, but still men, with ACL prevention programs and involving maybe 5 to 7 different exercises. So, and a lot of these clubs are doing it, but they really are not super proficient. Like a coach will take a class, so they have an hour seminar, and I don't know if it's appropriate to just leave it up to them per se. So, I've been thinking about the concept of this preemptive therapy where they're pretty well aligned and they know how to address deficits, and we can do these assessments that are like what we call functional sports assessments, that are dynamic assessments to see where they are and really talk about prevention, because he's right. Being injured is awful. It's awful. The downfall of anyone, including an adult, is when they get injured. The impact on a kid, yes, most of them will recover. Great thing about orthopedics is we can fix people. It's a very specific problem. They get better. They can get back to sport. But I will tell you, Steve, as we age and you look at like decline in terms of function, it's more about getting injured. If people say, what's the secret to longevity? I will tell you what it is. It's don't get injured.
And that's kind of the lost art, right? Because for both Dr. Cole and Ted, our physical therapist at Rush Physical Therapy we're visiting with, the lost art is everyone always goes to, it seems like they go to a physical therapist after the injury, right, Ted? I mean, if you can get these people to go see you before, as Dr. Cole said, I mean, we talked about the young women suffering those ACL injuries, whether it's box jumps, put them on a program to avoid the injury. And I think that's what people don't know that they can go see you guys about. It seems like a hassle in a way, let's be honest, but you know what? It's going to make sense because you blow out that knee and they're going to wish that they did it, right?
Yeah, we talked about, what's the typical length of a therapy session and those things. If you come in, hey, I'm starting soccer season, I'm starting basketball season, I'm training for this marathon, we'll typically set someone up with a program and say, this is how often I want you to do it. Go do this program for 2 weeks, come back and see me again, we'll review it, make sure you're doing everything right, and then you have your program going forward. So that doesn't need to be a 2 or 3 month long episode of care prior to a season or prior to a race or anything. That can be a quick episode of care, a couple visits, to set somebody up for the future going forward. They have these exercises, this program that they're comfortable with, and they can continue going on that program for injury prevention going forward on their own.
Hey, Dr. Cole, when you ever see a re-tear, like you see, you fixed an ACL and then you have the re-tear, is your first question, did you do your physical therapy? Did you do your stuff at home after your physical therapy ran out or your sessions ended, right?
Yeah, I mean, at first, it's evaluating an individual who re-tears their ACL is a process, and much of it depends upon what you're alluding to, what they went through to get to the point of release, but also the timing of when they have re-injury. And if it's someone who just got back and within a month of returning to sport, they re-tear, that's a little bit of a different explanation than someone who's been back for several years and have a re-injury. The one that is the most worrisome is the former, where they have had a really, what's for all intents and purposes, a good recovery, and then they get back and they re-tear, which happens between 5 and 8% of the time. If it's an early re-tear, that, Steve, is the first question I ask is, what objective assessments did you have before you got back? When I first started in practice and returning someone after an ACL surgery, I would sit in the room and say, okay, well, you're 6 months. Your leg looks pretty good. How do you feel? I feel great. All right, why don't you go back and play? Which was incredible that we release people that way with no real objective assessment. Now, everyone or who can goes through some type of video assessment or a functional assessment, which is data driven and has science behind it, is evidence based, to assess if they have side to side differences, to at least put our best foot forward to look for signs that they might re-injure. So it is part of the narrative for sure. And I think especially for injuries that have a preventable component to it, that's where what we're talking about right now about the value of physical therapy and exercise weighs in, because a lot of things are not in yours or my control in terms of injury or re-injury. This is one area that actually is in our control, and I can tell you it's an area where the hard work really pays off.
Ted, anything you want to add as we wrap up? How many locations do you guys have? And again, it's rushpt.com to learn more and to make appointments with you guys, right?
rushpt.com. We have just about 60 locations in the Chicagoland area. So,
wow.
And you'll be able to find any location at rushpt.com location, or if there's one near you and you know someone else that needs to stop on in, we can let you know what the closest location, whether it's work or a family member or a friend that needs to come in. We can help you find the correct location, like we talked about earlier, the correct specialty that you may need to see.
And we don't need a doctor's prescription. So is that what we call it, Dr. Cole? I mean, usually you give a prescription for
in Illinois,
physical therapy?
For example. I mean, it depends. Our listeners, it depends on what state they're in. There is some legislation that's allowed walk-ins for therapy that can go to insurance without a prescription. It's state by state, so a certain number of visits can occur without a physician's oversight. But I would say most therapy is probably driven by physician prescription.
Good stuff. Well, Ted, thanks so much for being our guest here on Sports Medicine Weekly, and continued success.
Great. Thanks for having me.
Our guest, Ted Kurlinkus, along with Dr. Brian Cole. I'm Steve Kashul. Hey, warm weather is here. Time to get outside, enjoy your favorite activities, spend precious time with family and friends. Aches, pains, or an injury should not be part of the memories you're making. The therapists at Rush Physical Therapy are here for you. With more than 60 locations throughout Greater Chicagoland, Rush's clinical experts will get you back to life. Go to rushpt.com today to schedule an appointment. Not sure if physical therapy is right for you? Request a complimentary consultation and discover the power of Rush Physical Therapy today. I also want to thank one of our sponsors, Midwest Orthopedics at Rush, MOR. They're among the international leaders in musculoskeletal health. Midwest Orthopedics at Rush physicians are all faculty in the Department of Orthopedic Surgery at Rush University Medical Center, which is currently ranked number 5 in orthopedics by U.S. News and World Report. Founded in 2003, MOR is comprised of internationally renowned orthopedic and spine surgeons who pioneer the latest advances in technology and surgical techniques to improve the lives and activity levels of patients around the world. The physicians at Midwest Orthopedics at Rush, proud to be the official team doctors for the Bulls, White Sox, and Chicago Fire Soccer Club, as well as the Joffrey Ballet. Visit rushortho.com to learn more. Schedule an appointment at one of Midwest Orthopedics at Rush's convenient Chicago and West Suburban locations. If you enjoyed today's episode, be sure to subscribe to us or follow us wherever you enjoy your audio and podcasts. Many thanks again to Ted Kurlinkus, physical therapist at Rush Physical Therapy in Lincoln Park. For Dr. Brian Cole, I'm Steve Kashul. Hope you enjoyed it. We'll talk to you next time.